and no inclusive development without a sufficient, motivated, and protected health workforce. In Windhoek, we came together around a shared aspiration to move Africa's health workforce agenda from rhetoric to reform, from fragmentation to alignment, and from short-term projects to sustained investment. The adoption of the Africa Health Workforce Investment Charter and the Windhoek Statement on investing in Africa's health workforce gave our continent a common political and strategic framework. The aspiration in Windhoek were very clear, that Africa countries would begin to treat health workforce investment not only as a health sector priority, but a national development, employment, education, gender, youth, and economic transformation agenda. This Accra Forum has shown that the vision of Windhoek remains alive and that it is gathering momentum. Over the past days, we have seen stronger evidence, deeper political engagement, and more concrete commitments. We have discussed how to plan better, train better, and retain better. We have examined how to link health workforce education to funded jobs, how to strengthen domestic financing, how to improve quality and competency in health professional education, how to protect and motivate health workers, and how to establish accountability for implementation. Most importantly, this forum has moved the conversation further from aspiration to action. The outcomes of this meeting provide an important opportunity to accelerate implementation of the Health Workforce Investment Charter across countries in our continent. They also provide a stronger basis for continental advocacy, especially at the highest political level. For Namibia, the commitments made in Windhoek were not symbolic. They continue to shape our national reflection and policy direction. We have pursued strategies to retain our health workforce. We are proud to report that our public health workers are amongst the second highest paid in SADC region, a deliberate policy decision to value their vital contribution. Coupled with aggressive recruitment drives that filled nearly 3,500 posts last year, and commitment to fill over 5,000 more this financial year starting April. We are actively creating attractive environments for our professionals. Our ongoing investment in local specialization, with hundreds of our staff currently in various advancing training programs, is designed to build a sustainable homegrown expert base. These numbers may look small for many of you here, but for us it's a significant number given Namibia's small population of about 3.2 million. It is evident that Namibia is embarking on health workforce reforms aimed at strengthening planning, education, employment, deployment, retention, and performance. Like many countries on the continent, we recognize that the challenge is not only the number of health workers we trained, but whether they are equitably deployed, adequately supported, efficiently managed, and retained with strong health systems. Mostly, can they easily be registered across African region without challenges from various health professional councils? We also recognize that health workforce reform requires whole of government action. Ministry of Health cannot carry this agenda alone. Ministries responsible for finance, education, labor, public service, planning, and local government must be part of the solution. Partners must also align behind country priorities using one plan, one budget, and one accountability framework. Distinguished delegates, as the country that hosted the inaugural forum, Namibia is encouraged to see Ghana carry this agenda forward with such clarity and ambition. We therefore urge Ghana, as this year's host, to champion the outcomes of Accra Forum beyond this meeting hall. In particular, we encourage the government of Ghana to take the outcomes of this forum to the African Union heads of state and government, so that health workforce investment can be elevated as a continental priority at the highest political level. The case is compelling. Africa's health workforce challenge is no longer a technical issue. It is a strategic issue for sovereignty, resilient employment, social stability, and economic development. It is about whether our countries can deliver essential services, respond to emergencies, retain skilled professionals, create decent jobs for young people, and build public trust in health systems. The call from Accra must therefore be bold and clear. Africa must invest in its health workforce as a foundation for universal health coverage, health security, and sustainable development. Let us leave this forum with renewed determination. Let us ensure that the Charter is implemented, that the commitments are monitored, and that the voices of health workers, communities, and countries remain at the center of our actions. Namibia stands ready to continue working with Ghana, World Health Organization, the African Union, Africa CDC, member states, and all partners to advance this agenda. From Windhoek, Namibia, to Accra, Ghana, to the African Union, Addis Ababa, Ethiopia, let us sustain the momentum for health workforce investment in Africa. I thank you.
Ladies and gentlemen, I think you should give another round of applause to His Excellency. He is telling us that we should, that once you go back, you will implement the actions that we have discussed today, monitor them, measure them, and ensure that they have made some impact on our various countries. Honorable, thank you very much. For Namibia to give us, for us to build these actions, and then supporting Ghana also to ensure that objective. And I think a statement also he gave some challenge to Ghana. So, Honorable Minister, I think you have to take note of that. It's urging us the touch to the higher level to ensure that decisions that you've taken here are implemented. Your Excellency, we want to invite one of our partners. I invite Professor Aliko Ahmed, Special Regional Representative of Director General for Western Africa Regional Collaboration Center, CDC.
Excellencies, ministers, and distinguished partners, good afternoon. I extend warm greetings from His Excellency John Kasaya, the Director General of Africa CDC, who really wanted to be here, but unfortunately he couldn't. So you are left by me, and I hope I will be able to communicate what is intended. I was meant to give an opening remarks, but I ended up not giving a closing remarks, but that worked. I'm really happy for that because we're really honored to be here, to be part of the convening of this successful workshop. But it also has a personal implications to me. The 3 days I've spent here has been really insightful, has been enlightening. A confession to make, I'm one of those who have been trained in Africa, and then I wasn't retained. I left 30 years ago, and I just came back about 4 weeks ago. So a lot of the discussion that has been happening over the 3 days have been really, really helpful. I've been in England for about 30 years. I was lucky to be the highest ranking public health officials in the English health system. I managed one of the 7 regions of England until 31st of March this year. I now join Africa CDC because of a number of reasons which I will try to communicate. My 4 weeks have been a very good induction, and this is one of the big meetings I have been, which I think is absolutely relevant. So my reflections will be just 3 key things. One, because we are in Ghana, and I'm evoking the principle or the spirit of Sankofa. This is an old Ghanaian tradition where you look back before you look forward. And I think what I've had over the last 3 days was a lot of progress have been made in Africa. Training capacity has increased more than 70% in the last 30 years, so a decade or so. And I think it's something that we need to celebrate. And most of you have driven that, and I think we should give ourselves a round of applause. Also, the second point is a challenge. Despite the progress being made, there are a number of challenges that have been articulated very well. From structural issues about training more, the shortfalls we have, and financial issues about the fragility of the financial system we are dealing with now, and then to systemic issues about training but not able to retain. When you retain, do you employ? When you employ, do they migrate? How do you bring them back? There has been a number of discussions around diaspora, people sometimes talking about them and us, but I think most of what I've also had, we know the solutions. So we're not just rehearsing the problems and talking about them over and over and over again. What I'm hearing is the commitment for solutions, and we know what those are. And I think part of those solutions probably is our mindset a little bit. The point made by the RD yesterday around circulation, I think is a good one. About movement. But I think it's not about about moving from one place to another. I think we are in an era where we need to think about brain circulation. There is no area that is just going to keep a particular set of skills, whether it's Africa or Europe. It's how we create the environment where we can learn and share and let people move across those systems. And I think that is probably the way forward. But the third point, which I think to me is the most important point, is about the hope and the optimism. And for me, one of the main reasons why I'm able to return to where I should have been in the first place. And this is a leadership. I think over the last year, 2-3 years, we are seeing a complete powerful convergence between science and politics. We are seeing leadership in Africa that is emerging, that is technically sound. We have heard from the regional director of the WHO. You've heard from people like John Kasaya. You've seen ministers here who are public health trained and now occupying political position. And we know that science is blind without politics, and politics is lame without science. You need both to come together. And I think for the first time in Africa, we're having those convergence, where leaders that know politics, that are legacy-driven, are working with technical experts to bring that amalgam that you need to bring action forward. And I think that scientific credibility and political legitimacy will be very important in terms of the future sustainable and resilient health system in Africa. To me, that's the attraction, and that's the hope. And I hope that that's the momentum we can build on. If you look at what has been set for us, we have the investment principles. We now have the political movement, as have been talked about, led by President Bola Tinubu of Nigeria. And then we have what was just launched around the Africa strategy. So we have the implementation pathway. I think now the action is just for us to make sure that we are not paralyzing ourselves with continuous description of the challenges to move more towards solution. And I think the reflection being here and the emphasis on the theme that we are moving from words to action is key. My last word about this is how partners work. I think we cannot afford to be in silos. It's an observation. I think people are very attached to logos in this region. And I think we probably need to find a way to go beyond logos. And I'm really glad to hear, I spent a good time with the regional director of WHO yesterday and some of his directors as well, and what I'm hearing in Africa CDC, and what our member states are saying. We cannot be duplicating things. We need to optimize, we need to synergize, we need to accelerate things in the same direction. We cannot afford to be wasting resources, and the time is now. So that's my reflection, and thank you very much for the opportunity. Thanks.
Thank you very much, Prof. We need to optimize, get the needed impact for all our countries. Your Excellencies, over the past 3 days, I think you all agree with me that you have examined the realities, workforce shortages, alongside unemployment among trained professionals. We have discussed and explored innovation, deployment, and retention through practical experiences across the continent. At this stage, have the privilege to invite Dr. Adelaide Onyango, the Director of Health System Regional Office, to give us a sample of our discussions.
Good afternoon, everyone. Good afternoon, everyone. Thank you. Excellencies, honorable ministers, distinguished delegates, colleagues, and friends. Let me break a little bit with protocol and begin by asking the WHO team that has been working behind the scenes to just stand up wherever you are so that this gathering can appreciate the brains and the muscles and the energy that has made that meeting possible. Thank you. Thank you very much. Thank you. Thank you very much. Thank you. Okay. So as we come to the close of the second Africa Health Workforce Investment Forum, I wish to begin by expressing our sincere appreciation to the government and the people of Ghana for hosting us with such warmth, with leadership, with, we felt so privileged. We were like privileged guests in Accra, and we thank you very much for that warmth. I'd like to acknowledge all the member states, my honorable, sorry to personalize it, but the honorable ministers who have such reflected with us, shared with us, and are going to carry the commitment forward. We really, really appreciate that. Your presence here, honorable ministers, permanent secretaries, directors general, heads of delegation, you have given us the inspiration that we need for us to stay focused on the possibilities that exist ahead of us. In Windhoek, Namibia, 2 years ago, Africa made a historic commitment. We recognized that the health workforce is not a cost to be contained, but an investment to be expanded, protected, and strategically managed. At that inaugural forum, member states adopted the Africa Health Workforce Investment Charter and the Windhoek Statement, together giving Africa a new political and technical instrument to move from fragmented interventions to coordinated investments, from short-term projects to system transformations, and from words to actions. Here in Accra, we have taken that commitment forward, looking at progress that we have made over the past 2 years. The forum has demonstrated that the Africa Health Workforce Agenda is no longer a technical agenda. It is a political agenda. It is an economic agenda. It is an education agenda, an employment agenda, and an agenda for youth and women and children. Above all, it is a development agenda for a healthier and more resilient and more prosperous Africa. Over the past days, our discussions have been candid, evidence-based, action-oriented. Even our fireside chat was evidence-informed. So that's how seriously we're taking these things. We have reviewed progress, but we know that the progress remains fragile. The stock of health workers increased. The density of core health professionals has improved modestly. And the projected workforce stands at a slightly reduced projection from what we had in 2022 at 5.85 million by 2030. That's still too large. It is not yet, therefore, the transformation that we need is not yet there yet. Too many communities still lack access to skills. Too many facilities remain understaffed. Too many trained health workers remain unemployed or underemployed. Too many young people graduate from health training institutions without a clear pathway, and they are not guaranteed decent, productive, and funded employment. Too many countries continue to face fiscal constraints, wage bill ceilings, migration pressures, and gaps in education quality. Then there's the paradox of we have a shortage of health workers, at the same time trained workers that remain outside the labor market. This forum has sent a clear message. training alone is not enough. Employment must follow education, and retention must follow employment. Plan, train, and retain. This is very important. Excellencies, honorable ministers, distinguished delegates, a major outcome of this forum is the renewed commitment to translate the Africa Health Workforce Investment Charter into country-level reforms and investment compacts. We have heard from countries that are already moving from analysis to action. We have heard examples of countries using health labor market analysis to inform national plans. Policy dialogues are ongoing. Education reforms are being considered, employment strategies, and all that needs to happen for us to translate the commitment that is renewed here into action and to deliver results. The message is clear. Countries do not need another isolated plan. They need one coherent investment approach that brings together health, finance, education, labor, public service, and other development partners around a shared workforce agenda, shared national health workforce agenda. Another important outcome of this forum is the strong call to link health workforce to education, education to job creation. So we've seen institutions across the continent expanding in number, very encouraging, but education outputs must be aligned to funded posts, meaning you have to train for absorption, and the service delivery priorities also will dictate the quality of training that we are bringing out of our academic institutions, our training institutions. So what is essential is not just to invest in a workforce, but to fulfill the needs of the population and the diseases that we see are beginning to cripple the development that our countries are aspiring to. Distinguished colleagues, the forum has also reaffirmed the critical importance of quality. We do not need only more health workers, but we need them to be competent, ethical, motivated, and well supported. This is why the work of health professions education, quality standards, competency-based education, and mutual recognition of qualifications is so critically important at this stage. When we talked about migration, we were looking at preparing our health workers for possible employment overseas. How about within our own continent? We should also be able to train for the countries that are neighboring to us. We have placed strong emphasis on data and accountability. Member states and partners recognize that we cannot manage what we do not measure. So strengthening national health workforce accounts, health labor market intelligence, workforce observatories, and integrated data systems will be critical for tracking progress, identifying gaps, and guiding investment decisions. At WHO, we are committed, and you have seen the 3 levels of the organization here in very, very enthusiastically involved. We're very committed to supporting countries to generate, analyze, use workforce data for decision making. Evidence must move from reports to policy tables, from dashboards to budget negotiations, and from technical analysis to concrete action. Excellencies, honorable ministers, distinguished delegates, the forum has called on accelerated action in 5 areas. 1, countries should institutionalize the Africa Health Workforce Investment Charter and use it as a framework for national reforms, investment compacts, and accountability. I think the stories we've heard from the front runner countries is very encouraging, that we can do a lot even when we have limited resources. Number 2, countries should strengthen integrated health workforce planning using health labor market analysis to align population needs, education, employment, financing, and service delivery. 3, countries should transform health professions education through competency-based curricula, quality standards, stronger accreditation, and alignment of training outputs with health system needs. 4, countries should expand decent health sector employment, including funded public sector posts, private sector employment, opportunities for sustainable financing, and so that we're able to absorb trained health workers. And 5, countries and partners should strengthen retention, performance, and equitable deployment, especially in underserved communities, fragile settings, and primary healthcare systems. On migration, we had very interesting discussions a little late in the process for us to really capture extremely useful reflections that have been shared on the countries that are already looking at, we're even learning new politically more attractive statements like core investment, working on core investment to ensure that we benefit something from the health workers that we pay so much to train, and yet we lose the best among them to other economies. So we need to look at that, and to be encouraged, I take from you, Professor Aliko, that hope, the hope that in fact many people who are out there are looking to come back because we are tied to our roots. We want to come back and build our own homes, our own continent. So, ladies and gentlemen, the outcomes of this forum must not remain in this room. I'm very grateful to you, Your Excellency, for already making that clarion call, and we hope that it's going to be repeated and it's going to be embedded in the heart of His Excellency, the President of this country, as he assumes their role at the African Union, so that this really gets to the highest level of the political support that it needs. On behalf of the Regional Director, Dr. Janabi, who had to leave, unfortunately, would have loved to be here to see the end of this, I wish to reaffirm WHO's commitment to walk this journey with member states and with partners. We will continue to provide evidence, norms, tools, and technical support. We will work with countries to conduct the health labor market analysis, develop investment plans, strengthen education quality, expand workforce data systems, and mobilize domestic and external financing. We will work with partners. Thank you very much, our partners represented by Professor Aliko and all the regional economic communities and other partners in the room, the representatives of the health workforce. Thank you very much for being here. We really look forward to working together. So, our vision is clear, a healthier Africa, and we have to get that together. But this vision will only be realized if every mother can be attended by a skilled health worker, every child can access essential services, every community can rely on primary health care, every health worker can work with dignity. Thank you very much. Again, we reflect back on the words of Her Excellency, the Vice President, on dignity, the dignity of work and the dignity of our workers. Every country should be able to plan, train, and retain the health workforce that it needs. And of course, that then expands to the continent. Let Accra be remembered as the forum where Africa moved from commitment to accelerated action. We've already had some action, but it needs to be accelerated. Let Accra be remembered as the moment when we agreed that no trained health worker should be left without a pathway to serve. Let Accra be remembered as the moment when we placed health workforce investment where it belongs, at the center of Africa's health, economic, and development transformation. I thank you all for your leadership, your commitment, your partnership, your passion for what we are going to do together to really transform here, Africa. Together, let us move from words to action, let us plan, let us train, and let us retain. Thank you. Thank you very, very much.
Ladies and gentlemen, I think you should give another round of applause for them. For the last 3 days, in just some 20 minutes. I think Doctor has done a very good work for us. Thank you very much, Doc. Ladies and gentlemen, for us to live today, we all agree with me that the value of this forum is how to measure by what happens after we leave this room. Over the past 3 days, we have exchanged ideas, challenged assumptions, identified priorities for the action. We now arrive at an important moment whereby we adopt an Accra Declaration for Health Workforce. It is my singular honor to invite our Honorable Deputy Minister for Health, Ghana, Honorable Dr. Grace Ayensu Dankwa, to formally present the adoption of the declaration for us.
Good afternoon, everyone. Distinguished ministers, partners, colleagues, health worker representatives. Based on the deliberation and collective input in drafting this declaration, on behalf of the government and the people of Ghana, as the host of the second Africa Health Workforce Investment Forum, it is my pleasure to read out the official declaration as the outcome of this forum. This declaration, as you have reviewed this morning, has 20 paragraphs. We, the ministers and representatives of government and key stakeholders across the education, finance, health, labor, and public service sector, attending the second Health Workforce Investment Forum hosted by the government of Ghana in Accra from May 6 to 8, 2026. Acknowledge that investment in competent, well-distributed, motivated, and protected health workers is a fundamental pillar for health systems, essential to universal health coverage, health security resilience, and the social aspirations of Africa. The progress being made by member states in developing and implementing health workforce strategies, national plans, and compacts, expanding educational capacity, and increasing employment and retention in Africa to reach over 5.7 million health workers in 2024, and the ongoing efforts to address the projected shortfall of 5.85 million health workers by 2030. Note with concern, persistent improvements in health workforce planning, education, employment retention, and financing, which has contributed to labor market failures, including the paradox of simultaneous critical need-based shortages and rising unemployment, resulting in notable constraints in access to health workers. Macroeconomics and fiscal challenges facing African countries, including the high debt burden, insufficient domestic financing for health, sharp contractions of development assistance for health, and suboptimal levels of health system efficiencies and productivity. Challenges in health professional education, including limited capacity to meet the projected need-based gap, misalignment of curricula with evolving population health needs, of digital technology, suboptimal regulation, notable gaps in health worker competencies. Accra Declaration of African Health Workforce, turning African health workforce commitment into action, plan, train, and retain. May 8th, 2026. A deepening crisis of reabsorption of health workers into the labor markets as reflected in the estimates that nearly 1 million trained health workers are unemployed in 2024, and that the region has only 46% of the health workers it requires. deficit in decent working conditions, including low levels of remuneration, insecure employment arrangements, inadequate occupational safety, health protection for health workers, and limited career opportunities, leading to physical and mental health impacts, burnout, occupational stress, migration, and maldistribution of health workers. Recall, the African Union Agenda 2063, the Africa we want, recognizing health workforce development as central to human capital and continental transformation. The WHO Global Strategy on Human Resource for Health, Workforce 2030. The Code of Practice for the International Recruitment of Health Personnel, adopted in 2010 by the World Health Assembly. The Assembly AU Declaration 6 of 2017, decision to recruit, train, and deploy 2 million community health workers across the continent. The Assembly AU Declaration 816 of 2022, decision AU Health Workforce Task Team, HWTT, to strengthen continental coordination. The Assembly AU Declaration 877 of 2024, decision of Nigeria as the AU champion for human resources for health and the community health delivery partnerships, thereby elevating health workforce and community health workers as political priorities for Africa's health security. Declaration of Astana 2018 on primary health care, which reaffirms the indispensable role of a competent and supported health workforce in delivering equitable, high-quality primary care services. The Windhoek Statement on Investing in Africa's Health Workforce, adopted in May 2024 at the inaugural Africa Health Workforce Investment Forum in Namibia. The Kampala Declaration and Agenda for Global Action 2008. For its principles on health workforce development, decent work, and migration management. The African Health Sovereignty Summit, Accra, August 2025, and the Accra Reset Initiatives, calling for health sovereignty, domestic resource mobilization, self-determined health governance, and the International Labour Organization Resolution on Decent Work and the Care Economy, ILC 22 Resolution 5, which commits to advance decent work through integrated and gender-responsive policies that ensure healthy working environment, labor rights, and social protection in health systems. Reaffirm the principles enshrined in the African Health Workforce Investment Charter, which calls on member states and partners to ensure leadership and stewardship, evidence-based health workforce prioritization, align and synergize through partnerships, stimulate more and better investment, and foster sustainability and accountability. Commit to ensuring leadership and stewardship to advance health workforce at the highest political level. Institutional role of government coordination across ministries of health, finance, education, labor, and public service. And formalizing commitments through government-led, multi-sectorial, multi-stakeholder health workforce investment compacts with clear rules, financing, and mutual accountability. Increasing domestic financing for health with deliberate prioritization of health workforce education, employment, retention, and protection, guided by evidence on the health labor market dynamics, population health needs, universal health coverage targets, and national development priorities, and to establish accountability frameworks to monitor and report on implementation of Africa Health Workforce Investment Charter, aligning and synergizing investment policies, entities, and partners around a one plan, one budget approach, strengthen competency-based education for health workers, harmonization of health professional education, quality standards, accreditation, and mutual reciprocal recognition of qualifications, and ensure coherence between education, employment, and retention policies to produce health workers who are fit for purpose and responsive to population health needs. Promoting employment and job creation in the health sector in line with international labor standards through progressive expansion of domestic financing, leveraging on digital health, enhancing productivity and efficiency, and urging international financial institutions, public sector, to co-invest in health workforce in Africa, leveraging and strengthening the role of private sector for health sector innovation, such as telemedicine, artificial intelligence for health sector management, and patient care, and local health commodity consumables. Promoting retention of health workers, particularly in rural and underserved areas, through provision of decent work, equitable remuneration, safe working environment, respect for labor rights, addressing the driver of burnout and mental health conditions, migration, and ensuring ethical recruitment in consultation with employers and workers' organizations and in line with international labor standards. And hereby call on the African Union Commission to table the outcome of the second Africa Health Workforce Investment Forum to the Assembly of Heads of State in February 2027. Call on governments, partners, international financial institutions, other stakeholders to support the achievement of agreed results under the African Health Workforce Agenda 2035 in alignment and government-defined health workforce priorities and strategies, and to formalize their commitment through national health workforce investment impact. As many people who agree that this declaration be adopted, say aye. As many people who agree that this... Okay, the ayes have it. Thus, Africa Health Workforce is hereby adopted.
Thank you, Honorable. Thank you very much. Your Excellency, as it is important to hear a reflection from one of our own distinguished delegates who share meet here, who resonate at the national level and at the regional level. To do that for us, invite Honorable Master for us.
Je vous remercie.
Thank you. I will first of all, even if Dr. Adelaide said earlier, I think in the program we have envisaged a session on vote of thanks. But first of all, like on behalf of the delegates and on behalf of my country, the Central African Republic, and on behalf of all the delegates, express evident in these deliberations that we have had on Workforce Investment Forum. It has been said in the various presentations made here that this forum has given us two convictions. The first conviction is that there is no more important research than research on health workforce investment. The second conviction, as Madam Dr. Adlet said, this forum is much more than a technical forum. Yeah, it's not a sector ambition, that is the health sector ambition. It's an overall ambition we have for the future of Africa in terms of resilience in the face of the crisis that we are dealing with, crisis that determine our capacity to develop in the area of health and the social sector. These are things we are taking home from this forum. Our prayer is that as we leave this forum, we can do everything. Indeed, most of us here are highly placed, and we should be able to do everything to produce results arising from the decisions taken here. So I'd like to conclude by saying that as far as the Central African Republic is concerned, we have provided testimonies in the previous forum. We gave a testimony of what we have started putting in place. We're going to continue particularly looking at the experiences that countries have shared, and particularly with regard to issues that our country is still dealing with. We're going to take advantage of what we have learned here and give concrete responses to the various concerns. I will end by wishing each and every one that you'll have the necessary determination so that what we've decided here together will not remain in the drawers, will not remain in this room, but will reflect our, in concrete terms, our intentions. Thank you.
Honorable, Your Excellencies, Honorable Ministers, ladies and gentlemen, we are gradually coming to the end of the program. And on behalf of the Minister of Health, the WHO, the organizing team in Ghana, and those from Afro, the WHO, we are inviting Dr. Fiona Braka, the WHO representative to Ghana, to deliver a vote of thanks, acknowledging the tireless of these partners, health workers who are here and who have been with us for the past 3 days. I think we need some thanks from a big person like Honorable Fiona to come and help us. Thank you.
Your Excellencies, Honorable Ministers, Deputy Ministers, Member State representatives, our partners, colleagues, and friends. Before this to an end, we want to take a moment to appreciate everyone that has made this possible. and those that have been working tirelessly for the past few months to make this Health Workforce Investment Forum a success. On behalf of the organizers, we would like to express our gratitude to our host government, Ghana, for the leadership and the warm Ghanaian hospitality that you have accorded to all participants. Please, a round of applause. We are especially to Her Excellency, the Vice President, Professor Nana Jane Opoku Agiman, who graciously forum and set the tone for our deliberations. We thank the Honorable Minister of Health, Honorable Kwabena Akando Minta, and the Honorable Deputy Minister of Health, Professor Grace Ayensu Dankwa, for their commitment. You are both so personally involved and committed to ensure that as a host country, all expectations were met. And we want to sincerely thank you, Your Excellency, Deputy Minister, and the Honorable Minister. Thank you to our member state ministers, deputy ministers, permanent secretaries, director generals, other heads of delegation, and distinguished representatives of member states that made it. It's so great to see us fully engaged up to the very end. Your active participation, engagements, and contributions have greatly enriched this forum. Thank you for being very open to share your perspectives and to learn from each other. Without your presence, this would be impossible. Thank you very much. We extend our deep appreciation to our funding partners for their generosity. Thank you, the United Kingdom Department of Health and Social Care. Thank you, the Global Fund to Fight AIDS, Tuberculosis, and Malaria. Thank you to UNFPA. We are deeply grateful for your contributions financially and as strong partners of WHO. Thank you very much. We also thank our technical partners, Fund, UNFPA, ILO, OECD, Working for Health Multi-Partner Trust Fund, the World Bank Group, Frontline Health Workers Coalition, CARE International, Africa CDC, Foreign Commonwealth and Development Office, Health. Thank you very much for your technical engagements. Special thanks to the Organizing Committee of the Ministry of Health, Ghana, and WHO at all levels, whose tireless ensured the smooth running of this forum. We have seen you work with dedication and with passion for several hours. You have done so. We are very grateful. Please stand and receive our big thanks. The local organizing committee of the Ministry and WHO, thank you very, very much. And finally, a big thanks to the hotel that has hosted us, the hotel staff, our vendors, the interpreters, whose behind-the-scenes contributions have made this gathering possible and accessible to all. Together, all these collective efforts have ensured the Accra Forum will be remembered not only for its commitments, but also for the collaboration that has brought us here. We sincerely appreciate partnership and your contributions. It's making this forum a huge success. Thank you. Merci beaucoup. Medase.
Thank you very much, Dr. Fiona. And I think you didn't add yourself to the local organizing committee. You were the lead. So can you please also clap for her? Your Excellency, colleagues, we've come to the end of the program. And for us to close properly, I especially invite our Honorable Deputy Minister for Health, Ghana, Honorable Dr. Grace Sudankwa, to close the occasion for us.
Distinguished ministers, partners, colleagues, and health worker representatives, over the past 3 days, we have engaged in a rich dialogue on how Africa can move from words to action in strengthening our health workforce. We have examined the evidence, shared the experience, and committed ourselves to the pillars of plan, train, and retain. For Ghana, this forum has reaffirmed our determination to lead by example. We have launched our health workforce migration policy and strategy, advanced our investment plan to recruit at least 16,000 health workers this year to support our free primary health care and Ghana Medical Trust initiatives, and demonstrated how evidence can be translated into policy and policy into action. These steps are not only national priorities, they are continental contributions to the African Health Workforce Agenda 2035 and our testament to Africa's sovereignty. We leave this forum with a clear message. Investing in health workers is investing in Africa's future. The return is undeniable. Stronger economies, healthier populations, and more resilient systems. But beyond the numbers, it is about dignity, equity, and ensuring that every community has access to skilled, motivated, and protected health professionals. As Deputy Minister of Health, and on behalf of the President of the Republic of Ghana, His Excellency John Dramani Mahama, and the Vice President of Ghana, Her Excellency Prof. Nana Jane Opoku Agyemang, and the Honorable Minister of Health, Honorable Kobna Minta Akando, I wish to thank the World Health Organization, our development partners, all stakeholders who have worked with us on this journey. I also commend our health workers whose dedication continues to inspire us and push us to think of innovative ways of addressing our challenges. Ghana reaffirms its commitment to transform health workforce investment into concrete actions, guided by the pillars of plan, train, and retain. Plan. Ghana will institutionalize health labor market analysis, finalize a comprehensive master plan for workforce education and intake, and establish a joint standing committee to align recruitment with fiscal space and national health needs. Train. Ghana will accelerate reforms in health professions education, rolling out competency-based curricula, expanding specialist training, embedding digital innovation, and strengthening accreditation systems while engaging diaspora professionals for mentorship and knowledge transfer. Retain. Ghana will operationalize its medium-term recruitment plan to absorb at least 25,000 health workers annually. Expand retention packages such as rural posting incentives and salary benchmarking, and deepen bilateral agreements to manage migration ethically and strategically. Let us now carry forward the spirit of Accra. Let us implement the Accra Declaration with urgency and accountability. Let us ensure that by 2030, Africa's health workforce is not defined by shortages and migration, but by resilience, innovation, and shared prosperity. As the host country, we will work through the Vice President, who graciously opened this forum, to fully brief His Excellency President John Dramani Mahama on the outcomes of this declaration. We will also encourage engagement with the African Union champions on health workforce. His Excellency President Ahmed Tinubu, to ensure that the outcome of this forum are elevated to the African Union Heads of State and Government Summit in 2027. This will be critical to sustaining the political momentum generated in Accra and ensure that Africa Health Workforce Investment Agenda moves decisively from commitment to implementation. May the outcome of this forum guide us towards a healthier, stronger, and more united Africa. On behalf of the government of Ghana, I thank you for choosing Ghana. With a few hours left of your stay, do find some time to see Accra. Please do not eat, if you want to eat jollof, please don't eat jollof off the street. Let me tell you where the best jollof is so you can show us that Ghana has the best jollof. I'll tell you, see me privately. As we shall meet again in 2028 to share our progress, and as we do in Parliament, where I have the greatest honor to represent the good people of Esikado Ketan in the Western region, I am honored to call the Africa Health Investment Forum duly adjourned. Thank you.
Ladies and gentlemen, you come to the end of the program. The team, do you have any messages for delegates? What I can say is that those who want to go explore town, as the Deputy Minister said, you can see the team at the downstairs, provide you with vehicle support so that you can go around town if you want to buy something or do any other. Or go and look good for jollof joints this evening. So thank you very much. Do you have to take pictures? Pictures? Okay. Thank you very much.
Thanks for making it. Were you supposed to come in the beginning?
In the beginning.
practicing my communication skills earlier.
What do you mean?
One day I realized how